doing presentations, and it's pretty neat. So technology is, we've perfected the technology this year. And today we have a virtual presenter, and so she's going to present with us. She's with the greenhouse. It's Miss Marlene Rodriguez Sandoval, and currently she serves as the Assistant Director of Clinical Services at the greenhouse. She's been a bilingual advocate and therapist for the past 5 years. Marlene graduated from Dalton State with a bachelor's in social work and then moved to Pittsburgh, Pennsylvania to obtain her master's degree. After receiving her degree, she returned to Dalton to serve the community she loves. Marlene is passionate about providing top superb services to every individual in the community. She's honored to be part of the greenhouse as they continue to expand their service. So I'm excited to welcome Marlene, and I'll turn the meeting over to her where she can tell us about her work at the greenhouse.
Thank you so much for the introduction. Can everybody hear me okay?
Yeah.
Okay, so it's a pleasure to be here presenting. I actually had the pleasure of presenting several years ago when I was working on a community initiative with Readers to Leaders. So that was about 6-7 years ago. I can't even. It's a pleasure to be back. And I can hear my echo a little bit, so I'm going to try to continue moving forward. What I have here today is really a review of the services that we offer. And then at the end of the presentation, towards the end, I do want to make a calling for a program we're trying to roll out called Advocate at Home. So I will go ahead and share my screen and my presentation with you all. Hopefully I can do this. Okay. I had it going. Let's see if it'll come up. Okay. I'm having some issues here getting it to pull up.
Marlene, did you so you hit the open share tray?
Right, I see it now. Here it goes. Can you see that?
Yep, we see it now.
Okay, all right. Thank you for being patient with me. Okay, so I am a licensed clinical social worker, and like my introduction said, I've had the honor to be with the greenhouse for the past 5 years. This past February 26th was actually my 5-year anniversary. So I did start my social work career undergrad at Dalton State, and then had the opportunity to obtain my master's degree in social work in Pittsburgh, Pennsylvania. But with that move, I always knew I wanted to come back and provide services, specifically bilingual services, to the Dalton community and to the surrounding areas. And so I grew up in Murray County and have kind of commuted back and forth from Chatsworth and Dalton. And so this is my community. This is the community I wanted to come back and serve. And so when I graduated with my master's degree, our executive director, Natima Walker, which I'm sure most of you know her, contacted me, and here we are 5 years later at the greenhouse. So I've definitely seen a growth and an expansion in our services. If you guys were familiar with us previously, started out in the early 90s on Morris Street, and we have actually been at our new location in downtown Dalton for the past 2 years. So we've definitely been expanding with services, and I'm going to be talking about those. So this is a list of all of the current services that we are offering at the greenhouse. So advocacy and support, forensic interviews, along with forensic medical exams, therapy services, counseling, mental health, prevention education, a 24-hour bilingual hotline, for anyone in the community who might need us after hours. And then community engagement, presentations like this, going out to the community, to the colleges, and talking about our services. So I'll talk about each of these in detail. So with advocacy and support, we're really talking about being that linkage with community members and with caregivers who are experiencing a traumatic event. So the majority of the cases that we see do involve childhood sexual abuse, particularly sexual abuse and physical abuse. And so through advocacy and support, we are able to connect with those families to provide information about the criminal process, the law enforcement process, the medical process, and to also be that linkage to therapeutic services or other services that that family might need during the duration of the investigation and their case. Answer a lot of questions. A lot of caregivers are not sure how to navigate the process after experiencing a trauma. And so that's where we come in. The first step throughout the duration of the process is to be an advocate and to be their support. We also offer the forensic interviews. Now, forensic interviews can only be requested for the greenhouse through law enforcement and or the Department of Family and Children's Services. So that's to say that a parent or a caregiver who might have suspicions that their child is being abused or has experienced a trauma will not be the one to request the interview. So based on child abuse laws, we know that that has to be investigated. So that has to be reported either to law enforcement or to the Department of Family and Children's Services. So currently we have 2 forensic interviewers who conduct the interviews with children, adolescents, and adults is something that we're also able to provide now. Those interviews are non-leading. We don't offer them any information that they don't provide to us, and they are finding interviews, like I said, for law enforcement and defects to complete their investigation. For years and years, the greenhouse had been offering services to children and adolescents, any minors. And since we are also a sexual assault center, we are expanding services to offer these services to adults as well. So we see this mainly with adult female victims of sexual assault who feel more comfortable speaking to a female interviewer. And so we have law enforcement present, and they view the recorded interviews in a separate location to allow that survivor to feel more comfortable. So all of these are recorded. The reasons they are recorded is so that the survivor does not have to continue to repeat what they experienced. And 2, so that law enforcement and the investigators can use that moving forward if the case moves forward to a trial. Something that we are very proud, and it has taken a lot of hard work to get going in our judicial circuit, are forensic medical exams. So we have several sexual assault nurse examiners for the greenhouse, and we started this program at the end of 2019. So previously, if you were the victim of child sexual abuse or a sexual assault, you would have to go to the emergency room if you wanted to have a forensic medical exam completed. And we saw that there were a lot of barriers to accessing the exam that way. If any of you have been to the emergency room, we know it's a long way. It's not a comfortable situation. And so we wanted to expand our services. The year previous to us starting the forensic medical exam program, I believe there were a total of around 12 medical exams completed for our jurisdiction. And that just speaks to the difficulty, the barriers. I'll share some numbers with you guys later on so you guys can have a comparison of the impact that us housing this program has had on our community and access to this exam by survivors. So part of the exam is for evidence collection, just like the forensic interview, But the other part, a very important part, is a wellness exam. And so we want survivors, whether they're children, young children that are 5 years old, or adult survivors, to know that they are physically safe, and for us to be able to direct them to any further medical services they may need. So it's a dual service, and it has taken a lot of effort from our executive director, our staff, our nurses. And so we are available to complete forensic medical exams 24/7. An expansion to our services includes having on-call advocates who go out. Several of us go out in the middle of the night during weekends to answer the call for a forensic medical exam and to be an advocate and provide support to that survivor during that difficult time. So we have been working really hard on this program. I am a bilingual therapist here at the Greenhouse, along with being an advocate. And we also have several other part-time therapists that work at the Greenhouse. And we are very, very fortunate to have them and their specialties that they provide. So we provide services. All of the services that the Greenhouse offers are completely free. And that is to reduce any financial barriers or burdens that the family may have. So a typical mental health appointment of 45 minutes can go upwards of $100 per session. And we offer free services to the child, the adolescent, and adults and their caregivers, absolutely free. And this is really an important piece for healing after they've experienced the trauma. And so we are serving Whitfield and Murray County. Last year, we were fortunate enough to hire 2 therapists, one that works with children and adolescents and one that works with adult caregivers, to serve our Murray County population. And so that has been a great opportunity for us to expand our services to Murray County, specifically related to therapy and mental health. We have always offered forensic interviews and advocacy and support to Whitfield and Murray County because they are part of our judicial circuit. Something else we have been able to expand on during this last couple of years is being able to serve survivors of commercial sexual exploitation. In our area, there have been several cases that we have been able to work with to provide these services through forensic interviews, advocacy, and therapy as well. So we are all trained, we are all licensed therapists, and we provide a mixture of different modalities, including trauma-focused services, play therapy, art therapy. A lot of our community always seeks to help us through different art supplies and things like that, because they know that that is something that we can use. And in a minute, I'll talk about some changes we had to make last year due to COVID-19, but we have continued to offer all of these services throughout 2020. Prevention and education. So what we have been able to do, and we again had to make some changes due to COVID, but in 2019, we were able to hire a part-time advocate who then became a full-time advocate, really going out into the community, specifically the high schools, to teach our curriculum of prevention education. And we use Lauren's Kids, which is a great curriculum. She goes out and she teaches 9th graders, high school students, about healthy relationships. And then in the city schools, our school counselor program and really utilized it. And so some of the goals from our perspective, something that we saw as a mandate, something that we saw that the Greenhouse really needed to do, is to participate in prevention and education so that we could hopefully in long term see a reduction in child abuse and sexual assault by ending this rape culture that is very prevalent in the community. We learn in our forensic interviews and in therapy that a lot of our children and adolescents don't have the information about empowering themselves to have healthy boundaries and to respect the boundaries of others. So we really have been fortunate to have the ability to share this curriculum and have students be open and participate in it. And so hopefully with this program, we'll be able to see a reduction in child abuse cases, sexual assault cases, and we're also hopefully developing a generation of students who are going to be advocates for themselves and for others around them who, when they see something that's unhealthy or something that might be abuse. We also have a 24/7 bilingual hotline. This is something that we also were able to start running at the end of 2019, beginning of 2020. It is free, it is confidential. There are bilingual advocates on the phone line. That means that we have an immediate response because as a nonprofit, we do have limitations and we do have restrictions. We do have comparatively a smaller staff compared to other organizations that are larger. And so having this tool, this hotline, is really a benefit for us as an agency, but a benefit to the community to be able to reach out and speak to someone, perhaps if they just have questions or they're trying to figure out the best route to take once they experience assault or they realize that their child has been abused. So going towards the COVID response, we did have to take a step back and really look at the program and service delivery that we were offering because we knew that cases were not going to stop coming in. Cases were going to continue to be reported, and so we were going to have to continue to provide services. So we came up with some restrictions and some guidelines. We had to make some changes. And so to that end, we ended up pairing up, since myself and a counterpart mainly provide advocacy services, and then we have 2 forensic interviews. We paired together and we were alternating weeks. That way, if one of us was sick or couldn't come in, then we knew we could continue this response. With therapy services, we moved all of those services to telemental health, virtual therapy, and we had a great with that as well. So all of our services throughout 2020 continued to take place, continued to happen with some changes to make sure that we were keeping ourselves healthy, but also that we were keeping our clients safe and healthy as well. Unfortunately, due to COVID-19, we did have to make some cancellations of our fundraising efforts. And in the past, we have had 2 major fundraising events, the Butterfly Ball, which typically happens in April, and then a newer fundraiser, which was Rock and Rappel, which happened in November. And so unfortunately, since those are community events, large scale events with a lot of people, we had to make the call to cancel those efforts. And so, of course, we are thankful to have other funding sources in our community and at this local and state level. But we did have to get creative and really think about another approach. So I am going to be sharing that with you guys. And hopefully you guys can be advocates and help us get that word out. So I want to share some numbers about 2020. If this is the first time you're hearing about the greenhouse, or if you are familiar with the greenhouse, numbers make a really big impact, and we can choose to look at them one of 2 ways. So if we look at this, last year we completed, with pandemic and all, we completed 267 forensic interviews. That means that there were 267 active and open cases of either childhood abuse or adult assaults. That means that 267 people sat in our interview room and completed a forensic interview. And when I say you can decide to look at things one of both ways, or 2 ways, would be that we're thankful that we have had the opportunity to provide services to 267 plus individuals, with including caregivers. And we can also think about how heartbreaking it is that 267 children, adolescents, and adults had to sit in that forensic interview. We completed 62 forensic medical exams. So not everyone that has a forensic interview has a forensic medical exam, but we completed 62 forensic medical exams in 2020. And if you remember, I mentioned the number 12 that were completed previous to us being able to provide the forensic medical exams at our agency in-house. With therapy services, we had 196 therapy clients receive services. And we're very proud to be able to provide that because it is really a great opportunity to see a child come in for their forensic interview, struggle, have trauma symptoms, complete a forensic medical exam, which can be difficult. It's definitely not traumatizing because we complete all of our services in a trauma-informed way, but it's a difficult and at times embarrassing process. And then to see them go through the therapy, at the end of that, it's a different child, it's a different parent, it's a different caregiver. So that piece kind of brings everything full circle. With prevention education, we did have to stop going into the schools, but we were able to, again, provide that curriculum virtually. So I didn't put a number with that, but we know that our students are still receiving that information. So I want to move forward and share this new initiative, this program, monthly giving program that we came up with since we have had to think out of the box and really get creative regarding our funding sources. So this program is called Advocate Home, and it is a monthly giving program that anyone in the community or outside of our community can participate in. So this is how it works. So what you would do, what anyone interested would do, would be that you would sign up at our advocateathome.org website. And what it does, it asks you to contribute monthly. And so you would be making a contribution, anyone who's interested would be making a contribution of a minimum of $15 per month. That's our baseline. That's where we're starting it. Of course, if anyone is interested in more, that would be great. But the amount is automatically deducted every month, and that includes any processing fees that might be accrued in the total donated amount. We also offer a tax receipt for any contribution, and those are always mailed out at the end of the year. So there are a lot of services that we can think of that we're already participating. If you have Netflix, if you have anything like that, where you are receiving a service, basically signing up, contributing this amount for all of the services that I've mentioned previously in my presentation. So we know that this program can definitely have a great impact and revenue potential. Our goal is to sign up 2,000 advocates. If we were able to do that with a monthly contribution of $15, that would be $264,000 of annual net income that would be generated that could help us continue to grow programs and continue to provide these programs at no cost to our survivors. So we are really trying to push this, and I would really appreciate you guys looking into it. I'm going to share all of our contact information at the end. If you have any questions after the presentation, let me know. If you just want to chat, you can call our office and ask any questions you might have. But we see this as a way for the general public, the community, anyone outside of the state who is interested in contributing to our services to be able to do that without thinking about every year, every month making a donation. It is automatically deducted. So our implementation strategy, having a goal of enrolling 25 people, and so say we enroll 25 people and then those 25 people contact another 10 or another 20, it's just going to continue to build. And so if you are interested in this, please let us know. We'd love to talk to you about this, and we'd love to be able to share this program on social media, and for you guys to help us share this as well. sharing your story about what you've learned about the greenhouse today. I completely understand that it is not everyone's cup of tea to have a conversation regarding the services that we provide and why we provide them. But as you saw in the numbers, this continues to happen every day in our community. And so sharing the story, sharing what you've learned, and the impact that it can have on our community, on our most vulnerable population, young children, is so important. So some things to remember. We did roll this out in December of 2020, and we are continuing to reach out to our community to really get input and feedback about this program, and hopefully we'll be able to get this out there and really have this funding source. I know it was mentioned that hopefully this year, with vaccines and everything happening, we'll have a new sense of normalcy with fundraising. But this is also a way for those who cannot attend formal fundraisers or events to still be able to contribute to the community. So we are excited to have this new program and hopefully have a good experience with this. So this is all of our social media contacts. Please be an advocate, share a story, whether you can participate in the Advocate at Home program, or whether you can share your story and any information you learned today from my presentation with others. I think it is definitely important to have an open conversation, an open discussion, honest discussion about this happening in our community, and letting people know that we exist and that we are able to provide these services, answer any questions, offer any support to anyone who might be going through a difficult situation. And I didn't list any statistics about who are our victims and survivors, but the reality is that it happens throughout socioeconomic statuses, throughout families, throughout races, throughout ages. It really does happen all across our community. So there isn't a demographic that doesn't experience childhood sexual abuse or sexual assault. And so we do want to be that service provider in our community, having top-notch services for everyone to be able to access. And that really can only happen if we have continued support financially and support in the community to help anyone who might be experiencing something difficult. So that is my presentation. I'm going to stop sharing my screen. And
Marlene, do you have time for some questions?
I sure do. I was going to say, if anybody has any questions, I'm happy to answer any of those.
And I'll start it off. I know I'm always surprised, or not surprised, but shocked by the amount of numbers of forensic interviews you guys do and so forth. How does that compare? How did 2020 compare to, say, 2019 or any other year?
Right. So based on statistics, based on what we know about reporting, we do expect to see a 15% increase year after year. So in 2019, we saw around 250. So that was about a 15% increase. And so we expect to continue to see that. This year, 2021, will be interesting as things start to reopen, as children continue to go back to school from virtual to in person, because school is really the place where children are able to have a safe place to report and disclose to. So we stayed busy 2020. I can imagine and predict the same thing for 2021. And like I said, we can see that as something that is very, very heartbreaking, that amount of children and teenagers being interviewed. But we also can see it as a service provision standpoint and know that they received the support they needed. But underreporting is definitely a factor. And so even though we had almost 270 interviews, we know that that's probably half of the cases that actually happened in our area.
Okay. Lynn, did you have?
You mentioned commercial
Were you able to hear that, Marlene?
I heard a tidbit, not completely. If you could repeat that for me.
Commercial child sexual abuse, is that
Yes.
trafficking? Is that what you're speaking
Yes.
of?
Yes, that is a common term that we hear: human trafficking, child trafficking, commercial sexual exploitation. We have had cases where we have been able to provide support to law enforcement, to the Department of Family and Children's Services. That happens in our community. And I think that as a society, as a community, we do have this thought of maybe the movie Taken, or, this happening overseas. The reality is that it is happening. When we say commercial exploitation, is the exchange of any type of good or service or money, whether that's $100 or that's $3. And so we have seen that happen in our community. A lot of times we see that when caregivers allow friends and family to come and stay with them. And so as a community, in a community scale, it is more directed at friends and relatives, acquaintances, than a stranger. So we haven't had many cases where a stranger just pulls up and abducts someone and then traffics them. It is a connection that's made in the community. And so we have received training during the last year with trafficked commercial sexual exploitation identification, how to identify that. We know that if children are abused sexually, they're at a higher risk for also being trafficked. And so that is really a connection as a child advocacy and sexual assault center where we're continuing to expand.
Any other questions in the room?
Ricky, about a year ago when schools began to close, for obvious reasons, some people said that the children needed to be, they were safer at home than in schools with the pandemic. Others, however, said that children, that was a safe place for some in school rather than at home. Have you had an occasion to work with school officials to integrate that idea into the closing or opening of schools? That's kind of a rambling question.
Okay, well, I can answer from what I understood from your question and kind of give you some information to that. So something that I didn't explain in my presentation is all of the elements that are involved in the case management. So part of a child advocacy center is to have a multidisciplinary team, and that involves law enforcement, that involves us, that involves defects, that involves the school system, the criminal justice system. And so the schools are always at our table. And the reason for that, like I said, schools are usually where disclosures are made. Schools are usually a safe place. With this year, we did see that a lot of children were experiencing more abuse in the homes, and they didn't have the opportunity to go to the school and disclose this if they were doing virtual learning. We saw an uptick in domestic violence. An uptick in domestic violence means an uptick in childhood physical abuse and sexual abuse. So we know that the schools are aware. Our school social workers do a great job at checking in with our students, with our clients that come here for a forensic interview. So working as a team really allows us to have those conversations and to let them know what we are seeing, and for them to let us know what they are seeing at the schools. We haven't had any direct conversations with specific or with school officials at an administrative level. Most of our connections are made boots on the ground with our school social workers and with our students. But I am definitely sure that administration, school officials use that as well as children continue to come back in for in-person school.
Charles, I think you had a question.
Yes. I understood in your presentation that now you have another location in the downtown area. Is that correct?
I don't know if you were able to hear him, but he's asking about your new location in downtown.
Yes, right. So we are in downtown. We don't give away our location unless you're coming for an interview because of the confidentiality, but we are at a more central location in downtown Dalton. And so you won't see any signs like you did at our previous location. You won't see anything like that because we do make it a place that's safe and confidential for our clients. But what I can tell you is that we are extremely happy with it, and that, you know, we're located in a safe location where we have been able to build and grow our programs. We were sharing a lot of offices and sharing a lot of space at our previous location. And now we are able to have room to spread out and to really make each service specific and specialized. But if you are interested in a tour or anything like that of our new facilities, please let us know, reach out to us, and we would be happy to share that information. But we're in a central location in downtown Dalton.
Any other questions? Dan?
I feel like I'd like to make an observation. I am so excited that this young lady came back because she's articulate. She's obviously so involved, excited about her opportunity to help these fortunate people that are become victims of the things that she has to deal with. And I just feel like I want to give her a round of applause.
Thank you. I appreciate that. I appreciate that.
Yeah, that's exciting when we see young professionals, they move off, but then they realize that they come back to the community they love.
Yes, that was my mentality. That was, I'm leaving Dalton for a bit and going to the north where it's cold, but I'll be back.
And we applaud you. Thank you.
Thank you, guys.
Ricky,
Yes.
have you taken questions from the internet yet?
Yes, sir. Yes, sir.
Okay.
Go ahead, Judge.
You know, this is some history that Marlon may not even know. And I feel a little bit like Bill Bowen. You know, for those of you who were in the club when Bill was the president, it was, let me tell you about my children, what my children have done this week. I feel a little bit like that now. But Marlon may not know this, but the logo for the greenhouse was drawn by 6-year-old Lucy Partain. The logo that you flashed up on the screen just a minute.
Yes.
She's the one that drew that. And Lucy now is a federal prosecutor in North Carolina. And just last week, she successfully prosecuted a human trafficking case with multiple victims. And it was a 4-day trial. And like I said, it's a successful prosecution. And so I'm real proud of her for doing that. And she's doing good work for, you know, for in your line of business for human trafficking. Another thing about Bill Bowen is for years, Bill Bowen was, and I see him sitting there, so I'm not talking behind his back. For years, Bill was was Santa Claus for the children at the greenhouse. He dressed up for many years and played Santa Claus for those children, and that was a really wonderful volunteer thing for him to do.
Yes. I was aware of that, and I actually had the pleasure of working with Pam, your lovely wife, when I was doing community outreach. So I am a history buff, so I did want to learn all about the history of the greenhouse and its inception, its creation, and how it's grown. And so it's definitely a very needed service in the community. And so I thank you for, as far as I know, you being instrumental in its creation.
And thank you, Bill, for being able to go and be part of the kids and being all those years. Yeah. Anybody else on the internet? Okay. Anybody else in the room before we close the meeting out? Well, I did want to end that. My first part of my career, I spent in law enforcement, and I was a detective. And the first thing that I realized that just shocked me was how many of these cases we have, how many child molesting cases they are, how many sexual assault cases they are. That's the first thing that hit me is, wow, this happens in our community. I was sheltered. I didn't have a clue. And if we didn't get a case on our desk every day, it was weekly, or it's multiple weeks. So it's just shocking. And the greenhouse folks did a great job. That's where all of our investigations started, at the greenhouse. We'd get the report usually from the patrol officers, And then right away, we would call the greenhouse and schedule a forensic interview because we don't want to taint the interview of any of the children that are coming through. So, and they always have great experienced forensic interviewers, and it was vital to getting these bad guys prosecuted who's doing these to our children and other folks in the community. So I just want to applaud you for everything you do, and thank you for advocating the greenhouse.
Thank you all. It's been a pleasure to share this information, and always is. I think that's a tool as well that we can use to just share information about what is happening, being honest and truthful about the reality of these cases, and being part of the solution as well. We have an opportunity to do that.
Okay, well, thank you for being with us, and let's give Marlene a hand.
Thank you all. Thank you all.